This is my IV piggyback skills video. So we have our MAR here. So we have patient Lotta Fallings, date of birth 10/5XX. We have allergies of tagamet and codeine, so we'll make note of that. So we currently have an order for cefazolin, 1 gram IV piggyback times 1 now for infection. We're giving it at 0800 hours and we're giving it over 30 minutes. So I'm gonna go over to the Pyxis and I'm gonna go drop my medication. So I'm at the Pyxi, I'm gonna wash my hands. So I have, again, patient Lotta Fallings here, date of birth 10/5XX with allergies of tagamet and codeine. I'm gonna drop the med cefazolin. So I have here cefazolin 1 gram, which we have cefazolin 1 gram ordered. IV piggyback times 1 now for infection. And then I see the medication is in 100 milliliters and it expires in 2052. So it's not expired, so it is good to give. So now I'm gonna go over to my nurse's station to do my second check. So again, I'm gonna wash my hands. I'm gonna check here. I have patient Lotta Fallings, date of birth 10/5XX with allergies of tagamet and codeine. So we have our medication here, which we have cefazolin 1 gram, which was ordered as cefazolin 1 gram IV piggyback times 1 now for infection at 0800 hours. The medication is not expired, it expires in 2052, and it is a 100 milliliter bag. So we did our second check, everything's good. And then I also see that we have normal saline 9%, 100 milliliters an hour IV hanging already. I checked with cefazolin and it is compatible, so it works there. So it's good to give. So now I'm gonna go do my medication math. So we need drops per minute. So we have currently, the bag here for our IV tubing set is 15 drops per ml. Per 1 ml. And we're giving currently in the bag of cefazolin that we have 100 milliliters here over 30 minutes. So we cancel milliliters. So those cancel out, we get the drops per minute we're looking for. So this can be to go turn to 2, I could turn to 1. So that's gonna equal 50 drops per minute is what we're gonna have the rate at, which is about 13 drops per 15 seconds, which is what, once I hang it, is what I'm gonna put it to. So now that I've done my math, I am ready to prep the med. So I'm gonna wash my hands. I'm gonna put my gloves on. So now I have my medication. I already did my second check. I have my IV set kit, which is 15 drops a milliliter, which is the correct rate that we need to hang it. So now that I have this, I'm gonna put this aside. I'm gonna make sure I untangle it, make sure this is clamped, which it is, so we make sure to not lose the medication. So now we're gonna get ready to spike the bag. So we're gonna take the top off here. So toss that there. Okay, so we got the top off, make sure to keep sterile. And then we're gonna spike the bag. Once the bag is spiked, we're set here. So we have that. Make sure to loop that there. I would put these and make sure that I have the, again, right tubing, make sure everything's good. So now I'm gonna make my label for the med. Okay. So we look at today's date, which is April 20th, 2020. And then I'm gonna put my initials, which is A, J, M. So now that I made my label, I'm gonna make sure that I attach it to my medication. It's here. So now that my label is made, I have my medication, I have my MAR, so I'm going to take off my gloves, and then I'm going to throw this away. and I would take and throw this for facility policy. I'm going to wash my hands, and then I will gather my supplies, which is also the alcoholic prep pad. I have my medication ready, and I have my MAR. So now I am ready to enter the patient's room. Okay, so knock, knock, knock. Hi, I'm Alex. I am your student nurse here today. I'm here to give you your antibiotic. Is it okay if I verify your name and date of birth here?
Yes.
I see you, what is your name?
Lotta Fallings.
Okay, I see that on our MAR as well. What is your date of birth?
10-5XX.
Perfect, we have that. And I see you have an allergy alert band. What are your allergies?
Tagamet and codeine.
I see that here. What is your reactions to those?
I get a rash.
You get a rash? Okay, we'll make sure to not give you that. So we're not, and now I'm going to assess your IV site for any signs of infection, redness, or swelling, which I check here. There is no redness or swelling or signs of infection. Are you experiencing any pain?
No.
No? Perfect. Is it okay if I do my third check right now?
Yes.
Perfect. So I'm going to go back over here. I'm going to do my third check. So I have patient Lotta Fallings, date of birth 10-5XX, allergies to Tagamet and codeine. So we have the right patient. Now we have cefazolin, 1 gram IV piggyback. So I see here cefazolin, 1 gram. So cefazolin, 1 gram IV piggyback. Now it's over 100 milliliters, and we calculated the 50 drops per minute, which is about 13 drops per about 15 seconds, and it expires in 2052. So it's not expired, so we're set to give it. It's good to go. And we're giving it at 800 hours in her right arm. So now that I did my last safety check, I'm going to enter the patient's room, or I'm already in the patient's room, so I'm going to have this set up here. I'm going to wash my hands. I'm going to put on my gloves. Oh, before I put on my gloves, I'm going to make sure to educate you on this medication. So this is a antibiotic. This is to help treat your infection. Side effects you may include are a rash, or those are reactions. So you might get a rash or hives. So let us know if you have that. And side effects are you may experience GI upset or stomach ache or nausea or vomiting. So if you experience any of those, just let us know. Do you have any questions?
No.
Okay. So now I would wash my hands. I will put on my gloves. So now I'm going to make sure that this is hanging lower, and that's the right solution here. We have the right one hanging and it's dripping. So now we're going to take this here and we're going to start attaching the medication. And since we're hanging it via gravity, I'm going to hook it to the closest one here. So I'm going to grab a hold of the port. No. Okay. I'll grab the alcohol prep pad. I'm going to clean for 30 seconds. Okay, it's been 30 seconds. So now I'm going to attach the port. Okay. Now that it is attached, I'm going to back prime. And I would back prime until it fills up the chamber about a third to half the way full, and then I would make sure to do this until all the air bubbles are out. So I'm going to back prime. Make so then now that it's back primed, I would do this until all the air bubbles were out, and then I will clamp it shut. Now I'm going to make sure this is hanging lower, and I'm going to hang this up here. And are you experiencing any pain at all or anything like that?
No.
Okay. So I'm going to check, and now because of the math we showed here on the back, which is 50 drops a minute, I'm going to make sure that it's hanging for, or we're going to set it for 13 drops for every 15 seconds. So I'm going to calculate it here. Oh, before I do that, I'm going to make sure I clamp off the primary tubing. So now I'm going to unclamp this, and I'm going to make sure that I do it. I'm going to be very careful not to let out too much. All right, so I set it for 15 or 13 drops a minute. So now that we have it hung up at that time, I would check and make sure, are you experiencing any pain at all?
No.
All right, and with this, I'm gonna check back on you in 30 minutes, and if you experience, to restart your primary line and check on the second, or the antibiotic that I gave you for your infection. And do you have any questions at all?
No.
All right, so I would grab this, I would throw this away, I would throw these away per facility policy, and then I would wash my hands. And now I will go document. So I'm going to bring my MAR over here, and these would be thrown away. And now I'm to document here. So we have patient lot of fallings, date of birth 10/5XX, with the allergies, tegamet, and codeine. So we gave cefazolin 1 gram IV piggyback at 0800 hours. I'm going to put my initials. And we gave it the medication in her right arm. So I'm going to put right arm. Now because I gave the med at 0800, I'm going to put a cross through it. And I'm going to sign my name, Alexander Nushko, SNSCC. And then I will put my initials so people know that I was the one who gave the med. And that is it for the skills video.